right. Good morning, everyone. Oh, we got a couple more hopping on. Great. Do you think we'll have almost everybody on in just a second? So we're going to go ahead and get started for the sake of time, keep us moving. But I'm so excited to see all of you today. And I'm really excited that next month we'll get to see you in person. So that's always fun to me to remember that soon we get to be together in person. And that's always a good time. So, all right. Well, thanks for joining us today. Today's topic is going to be accountability and performance management. We'll hear from Sonia most of the time. I put in our weekly email that she might not be with us for jury duty, but she was dismissed, so we get her today. We would have loved to hear from Ty also, but I'm happy that we got to keep her today. So, talking about accountability and performance management, we're going to get started with something that has nothing to do with accountability and performance management, but I just think it's fun. I like this icebreaker, so I decided we're going to do this today. I'm curious, what would your welcome mat look like today? It always gives a good idea of what your mood is, what your overall personality is. Feel free to come off mute and explain or drop in the chat. Mine depends on the day, but most of the time, yes, Amazon, this house again would be mine. Right or wrong, they get me with their deals. It's Prime days. I may have ordered a few impulse items because it was too good to pass up. And I might be surprised when it shows up what I actually got. So what do you guys think? What would be yours? Welcome-ish is definitely my mood some days, Jerry.
Uh, I think that today mine is, uh, I don't know about the kids, but the animals, because it's a zoo inside. It seems like it's a zoo today, this week for me. Um,
Do you have kids home from school? Is that what makes it a
I
zoo
don't
for you?
have kids is a
Oh,
thing,
okay.
but
Gotcha.
I'm dealing with a lot of kids.
Yeah. Yep.
Um, but just this week just seems like a zoo.
Everyone welcome here. Yes. Loved that one. And stay a while, but not too long. Yeah. People can definitely wear out their welcome pretty quickly. I did have to change. I had this from last year and I had a fall one and a winter one. And I almost left it on because honestly, I'm one that can't do a seasonal mat because I would forget to change it. I would probably be a Christmas all year round, even though that's not who I am, just because I forget to change it out. So I can't do a seasonal one. Amazon, yes, thank you, Afton. I think you and I we got a lot of alignment there. All right. Well, thanks for playing. Again, I just thought somebody do this. Has nothing to do with our topic for today. Sometimes I try to align with the topic, but this one was just for fun. Dante, that is honestly half of mine. If you visit me on a Monday, you're probably gonna have a clean house because weekends are my clean the house days. After that, you've probably missed your window and you're gonna have to wait till next week if you want to see it clean. So I'm with you on that as well. All right. Again, thanks for playing along. So now let's get into our actual topic for today, the accountability and performance management. Looking at what we're going to be doing today, we're going to hear from Sonia most of the time today. So she was talking to me about how she has this training that she can do in days worth of time. So we're getting the condensed version, but really interesting for me to hear about some of the experience she's had in this area and really some good things to start thinking about when we're thinking about the performance improvement and quality that we want to see in our public health work. So we're going to debrief. We'll talk about final projects for just a little bit, go over some plans for the next session, and we're going to give you the evaluation and get you out of here. So that's our plan for today. There's our objectives for the day, really just looking at what those quality improvement things mean for public health, practicing with some of the tools, describing levels of measurement, the role of performance management in achieving your organizational objectives, and then understanding how assessing those objectives can help build upon improving strategies for what you want to achieve within your health department. All right, I just have super quick overview because I'm going to leave most of it to our great speaker today. But just the core skills, a reminder that we pulled some of the core skills from those foundational public health services. So there's more, but these are the ones that we're going to focus on mostly today. So maintaining a performance management system to monitor achievement for your organizational objectives, identifying and using evidence-based or promising practices when implementing the processes, programs, or interventions, and ability to maintain an organization-wide culture of quality and use the quality improvement tools and methods. Those are the core skills that we're going to focus on today. As always, do we expect you to be an expert when you leave here on all of these core skills? No, but we're hoping to give you an overview of what this means and give you some things to think about and tools to use as you move forward in your work. Like I said, there are other core skills touching a little bit on these two, but that's not our main focus for today, but just a reminder that there are more core skills in those foundational public health services for all of the capabilities that we look at in each of the months we have sessions. So just a reminder that you can always look there for all of the core skills that are under each of those capabilities, but we're not going to focus too much on these two, especially with the Public Health Accreditation Board standards. Good to know about them, but not something to focus on heavily here. And then creating accountability structures and the internal and external equity related measures or metrics. Again, that's just a reminder that everything, even though equity is its own capability, all of the other capabilities do have equity built into them as well. So I'm curious from you, when you think of quality in public health services, what's one word that you would use to define that? And we're going to do a word cloud for this, so I'll pull that up here in just a second. But if you would use either the QR code or you can go to menti.com and use the code 55069310. And I'm going to change my sharing real quick, but it will still be up on the screen. So give me 1 second to pull that up while you're thinking of what your one word would be. All right. Should be seeing the Menti poll. Is that what you guys are seeing right now? Okay, great. Yeah, let's see what you guys put in. Compliance, awesome. Focused, thorough, competent, love it. I'm sure you guys have done word clouds before, but just in case you didn't know, the words that are biggest are the ones that are entered more times. So it looks like several of you like the word compliance to go with quality. I think in our jobs, we deal with a lot with the compliance, right? You're going with standards for the different programs you do. So compliance is a really good one to make sure that we're meeting all those standards, federal, state, local. We've got regulations and just best practice standards that we all want to follow. I love care, welcoming, and joy. I love that you guys are putting that in for quality. When we're focused on quality, are we meeting some of the standards that we set within the health department? You know, making this a welcoming place for our clients, bringing joy to our work. It doesn't have to be all about compliance. That's super important, but we have some of those best practices that probably we set for ourselves because we want that to be the environment that we're serving our clients in. And I'm glad that quality leads into that. Evidence-based. I love all these. Empathy, yes. All right. Thank you for playing. These are really good one word definitions of quality and what that means to you guys. And hopefully, as we're going through the presentation today, you'll be thinking of some more words to describe quality and how you would bring that to the work that you do. All right, so I'm going to take this down. Sonia, I'm going to turn it over to you to start sharing. All right, and I just have one more slide before I turn it over, but playing off of what we just did with the word cloud, when you're striving for quality improvement in public health, why is that important to you? It can lead into what you were saying with what your definition of quality improvement is, but why do you think that's important? Knowing that you have not had this presentation yet, so you might be thinking, I don't really know what quality improvement means. But what do you think? Why is that important? Feel free to come off mute, or I see some of you dropping in chat as well.
I think it's important in public health because we are there to help, especially the people we serve, are there people that are probably not going to get served somewhere else. And so
Absolutely.
for many people, we're their only option. And so it needs to be a quality that they want to come back to us and
I
want to
love that.
continue to be healthy.
Love it. You're serving vulnerable populations and you want to make sure that they're getting the best quality. I love it. That kind of plays to what Jessica said. I'm reading the chat now. Quality leads to improved trust. Absolutely. You want them to have a quality place that they can trust coming to get good care and good information. And providing the best services. I have a couple more people that anybody else want to come off mute and share what you think, why it's important?
I responded in the chat, but I said that these values are important in public health because it ensures equity for all in the community. Um, Obviously, that's really important to have empathy and even evidence to back you up when communicating with others and educating, because everyone comes from different backgrounds and levels of understanding. So it's important to meet everyone where they are.
Absolutely. I love that as well. Again, having that equity component go into everything that we do, making sure that you're giving good quality service to everybody in the community and everybody's getting that opportunity to get good quality care from you guys. Thank you. And consistent care, yeah. Consistency is important. Yeah, you don't want to go from one community or one county and the next county, you're getting a completely different experience, or even within the same county. Especially like you Sedgwick County folks, I know you've got several clinics. You want to make sure that you've got that consistent service being provided, and that leads into the trust and communication as well. All right. Thank you all. We are going to move on with learning more about what quality improvement actually is when we're looking at this accountability and performance management topic. So keep thinking about that lens of how you would define it and why you think it's important as we move forward. Thank you all.
Thanks, Emily. I'm excited to be thinking and talking about this with you all. If you have been trained in quality improvement in some way, in quality improvement and performance management, and want to drop what that training experience was, you can drop that in the chat. I recognize that we are all coming to this with a broad spectrum of experience with performance management and quality improvement. So I suspect that there are people in this room who could teach this class. And I suspect there are people in this room who are hearing quality improvement and thinking, I think I understand that. And when we're done today, you're going to go, I didn't think what I thought at the beginning is not what I think now. So I'll tell a funny story, a story of in 2006 or 7. Ty Kane and I wrote a grant for to the Robert Wood Johnson Foundation because we wanted to do quality improvement work at Sedgwick County Health Department. And we wrote this whole grant and we didn't get funded. But I look back at what we thought we were asking to do and what we thought quality improvement was at that time. And we were like not trained and not informed. And basically in 2007, Ty and I both went to a workshop that KDHE was doing on quality improvement, and that lit my fire about my love and joy for quality improvement. And for the last 15 years, I've been professionally training health departments across the country, um, literally from Boston to Guam, um, across the country, doing quality improvement training. So I don't, I love public health. And I've been in public health for over 20 years. But the thing I know most about is performance management and quality improvement. And if there's somebody who's spending more time thinking about performance management and quality improvement in our state, I'd like to know who it is. So usually, as you know, we get somebody else to teach you. Like last time, we had 3 guest speakers. When we get together in August next month, Emily and I are going to be watching our awesome speakers just along with you. We're not teaching, but this session you get me. So I'm going to talk a little bit about this, and please keep those notes coming in the chat. Yeah, a hospital setting, Monica, is a great place to learn about quality improvement and especially quality assurance. So when I heard you guys talking about compliance, quality assurance is making sure we're doing what's expected. Like we said we would do a depression screening for every uh, pregnant mom, and now we're going to make sure that we're actually doing a depression screening for every mom. That's compliance. Quality improvement is a forward-thinking idea that we're looking ahead for. All right, so and one more thing, Emily mentioned FAB as one of the standards that we're not really, one of the skills that we're not really fostering for this. In the accreditation standards for public health departments, which is like, how do you know when your agency is doing all of the things? There are 8 core plans, 8 things that every health department is supposed to be doing. And one of them is a quality improvement plan, and one of them is a performance management plan. So, quality improvement and performance management are so important that they are core things. In fact, the standards say that your agency needs to have one performance management system, and that your quality improvement plan needs to include training for your staff and completion of projects. And we're not going to go into all of the things it takes to do a QI plan in this workshop. If you're curious and want to know more about that, that is a conversation that I am very excited about having. So let me get my screen the way I want it. Here we go. All right. So we are going to be talking about what is a performance management system. We're going to be talking about designing measures. I'm going to describe what is QI in public health. We're going to talk about the PDCA model. We're going to talk about a customer focus, and we're going to practice with a couple of QI tools, including flow charting and cause and effect. And we are getting ready to go into some small group conversations. You will have 3 or 4 times today where you get dropped into small groups. So I always like to know what's going to happen today. We're going to talk in small groups. We're going to talk as a whole group. We're going to do a long, like for a half an hour, we're going to work on a poll and have a conversation about that poll. So actually we're going to be in small groups maybe 8 times to get today. So there's a lot of that going on. And I can't get this to play the way I want it to. My screens don't want to do all the things I want them to do. All right, so we are going to first talk about change, because if we're going to improve, improvement means that we are going to change. So change is not always easy. So I'd like you to think about something you've changed recently. It could be at work, it could be at home. Why did you make the change? How did it go? And what helped or hindered the process? So we're going to pop you into some small groups to have a very quick conversation. This is your first small group conversation today. And we're going to go to those small groups for like 3 or 4 minutes. So it's not a long conversation, but we want you to think about what are some of the things that you've tried to change and how did it go and what helped or hindered the process? And it can be work, it can be like you change the paint color in a room, it can be anything. It doesn't have to be, you don't have to do deep thoughts, okay? You can go any direction. All right, Emily, are we ready to do breakout rooms?
We are. I just sent them.
Awesome. Okay. All right, welcome back, everyone. All right, when we sent you to groups, we asked you to think about change. And what I'm curious about is what are some things that you guys talked about that help or hindered the process? So I'm not interested in the change that you were working on. I'm sure it was important and I care about that, but I'm curious if you'll share in the chat or unmute and share like what helps change happen and what holds it back.
I think sometimes if you're going to make a change and you let others know that the change is coming, it's more accepted than when you make the change. And it might be a good change, it might be a very positive change, but people just don't like change to be spurred on them.
Yeah, thanks, Hector. I agree. I think a little time to warm up to an idea is really important. Um, you know, most people I know who get pregnant, most are really excited and hoping for that baby. Not everybody, but most of the time it's a good thing. And it's a good thing that it takes like 8, 9 months to like prep and think about that. People need some time to warm up to that big change in their life. And even then, they're not prepared. Um, Mindset. I see a couple of people saying mindset, man, that's important. And Lori's agreeing with Hector. We got to communicate early and often. You know, like our office is moving. Emily and I are moving to a new space. Well, we're not because we work from home, but our team's office is moving. And we've been working on this for 6 months, and it's still going to be like hoped for and hoped. And we had this great plan, but it's going to be hard. There's a loss that people are experiencing. Lack of organization holds things back. So true, Monica. The hardest part in a move is when people feel disorganized. People use a lot of trial and error often. Yeah, that's true. And if we can reduce the amount of trial and error we do, we can probably improve the process. Like we can anticipate some things. And that's one way that QI tools are trying to help us. Yes. Um, Motivation, like why are we even doing this? This is a really important thing, I think, for people who are grown-ups. Like we need to know why. Like because I said so does not work for adults. We need to have some rationale, like why is this important now? We're going to talk more about that right now. All right, so thanks for thinking about change, because quality improvement is change, because if we're going to do something differently to improve, that implies change. Now, this is going to maybe feel like a bit of a left turn because I'm going to talk about joy in work, and not just the concept generally, but specifically. The Institute for Healthcare Improvement. This is a group that works on quality improvement for hospitals. In fact, if you did the homework and you watched that little 11-minute video, Dr. Mark Evans on the whiteboard, the Institute for Healthcare Improvement commissioned and created that whiteboard video. So they're a big driver of quality improvement in hospital care. And they created this framework called Improving Joy in Work. And the idea is that we get better patient outcomes. We get better when people are happy at work. It actually makes a difference in outcomes. And the National Association of City and County Health Officials, NACCHO, saw that resource and said, hey, Institute for Healthcare Improvement, can we do some modification for that and make a Joy in Work toolkit based on your framework for public health? And they said, take the whole thing. We want more people to have joy in work. So they did. And I'm not going to go through this whole Joy in Work toolkit. I'm going to look at one thing. This is a graphic that's in that Joy in Work toolkit. And you can see at the heart of it, we have happy, healthy, productive people. That's what we want. I want to be a happy, healthy, productive person. I want all the people around me to be happy, healthy, productive people. And you can see that that dark circle, which is like for senior leaders have a responsibility to foster every area of this. Managers and core leaders are kind of like darker teal that, or maybe lighter teal, depending on how you think about it here. They have some responsibility for some of these components. All of us have responsibility for supporting real-time measurement, wellness, and daily improvement. So, but that's enough about that. I only wanted to show you the three of these ideas. One, that we support joy in work when we have real-time measurement. How do I know that what I'm doing is contributing in a positive way? What exactly have I contributed? Um, so people need systems for feedback. We love the fact that you complete an evaluation of this course. Emily and I will read those details and the results before we start our August session because we rely on your feedback. That is part of our real-time measurement that brings us joy in work. We find out what works, what didn't work. We make tweaks all the time based on your feedback. Second, daily improvement. Um, what are our opportunities to use improvement science to proactively learn from what's failed before and learn how we're going to do it better in the future? So daily improvement, people feeling like they have some ownership over this um, gives them hope that they're part of a solution. We all want to be part of a solution. We want to be contributing like fully mature adults want to help. We are in a helping profession and we want to help in our agencies as well. And last, meaning and purpose. That daily work is connected to a vision or a mission for the future. So I love this idea that daily work, in that description there, it talks about line of sight. Like, I do this thing right here so that this thing that's far out happens. I see this client today because we want to have healthy people in our community. I deliver this training today because I care about the public health system in Kansas and I want it to be the strongest system we can have. Like that line of sight between I'm doing this thing and it connects to this broader mission, it's helpful when people feel that. Um, and I have been in places where this was really obvious. So, quick left turn again. My husband and I spend a fair amount of time eating at Old Chicago. Like, this is something that happens 2 to 4 times a month, maybe more. He has a mug. If you've been to Old Chicago, you'll understand what that means. We were talking with one of the wait staff that was a frequent wait staff person that we had, and that person, when we lived in Wichita, the East Wichita Old Chicago is one of the busiest Old Chicagos in the whole brand. Um, they have they have more staff, they have more turntables, they have more beer sales. I mean, they're tracking lots of things. Why do I know this? Because this waitress was telling us all about the real-time measurement. She'd just gotten out of their staff meeting and she was telling me about their real-time measurement and she was super proud of the fact that there's such a busy store and she connected meaning and purpose to the thing that she was doing. I'm telling you, if we can do that at a restaurant, we can do it about something that actually matters, like the health of our public. We do really important work to influence and support people. We can help with this. And so I want happy, healthy, productive people. When I think about why am I so invested in performance management and quality improvement, it's because I fully believe that it adds to hope and joy. We can influence a better system. And I think that sometimes when I feel stuck in the muck, like, why am I even doing this job? We all have these moments. I feel them most when I am less clear about what is it I'm even doing. So I need some clarity about measures. And I need some clarity about how the work that I'm doing today connects to a broader, meaningful purpose that I care about. All right, very briefly, if you really want to learn more about performance management, there's a very small book that I am a co-author on. Like, this is how much I nerd out about this. A colleague of mine, Amanda, wanted to write a book, and I said, all right, let's do it together. So we did it, and Jack helped a little bit. All right, let's talk about what is a performance management system. And so we're going to distinguish between performance management, which is using performance management or performance information to make better decisions. We all do that all the time. Um, we have been very fortunate to get a new car in the last 3 years. And one of the things that car does that my previous cars didn't do is it tells me when someone's in my blind spot. And it also beeps at me when I get too close to the line. All right, this is real-time performance information that helps me make better decisions. I love that most of the time. Sometimes I'm like, quit shaming me. I'm a little too close to the line. But it's performance data. It tells me how to make better decisions. A performance management system is using performance information on a regular basis that is a continual, repeated cycle where we monitor what we're doing, we analyze what we're doing, and we intentionally improve on it. Sticking with that car idea, I don't know if any of you have ever done those things that some insurance companies let you do. They'll ask you to do a plug-in in your car and they'll track your driving. And then you get feedback like you have too fast to starts or you brake hard too often. And the idea is that they're trying to teach you to be a better driver. And then they incentivize that by analyzing what you're doing. And if you get better, you save money, presumably. I've never done that, but I know that it's a thing. Um, and it is a performance management system. It's taking data over time, analyzing what's happening, and figuring out how to improve. I'm curious if any of you have an agency-wide performance management system. It might be an Excel spreadsheet. It might be a software program you use like Clear Impact or ClearPoint or something else, Achieve It. There are lots of performance management systems. If you're using a performance management system, I would love to know about it in the chat. I'm going to keep going because I have a lot I want to talk about with you. I'm going to continue to clarify this. So performance management is using data to make informed decisions. I like to use my Apple Watch as an example. Any other fitness tracker people with me? Get a little thumbs up or hands up. I got a few performance trackers. All right. My performance tracker will tell me how much I've exercised. It'll tell me how many hours I've been standing and not just standing. I had to move while I was standing. I will lose an hour of standing talking to you standing still. It'll tell me whether or not I'm meeting my calorie goal. That is not a performance management system. This is point in time information that tells me that day, how did I do? Keep answering the chat because I'm gonna come back to that. This is a performance management system on my phone. I can pull up and I can look back over a month. So here's August from a couple of years ago, actually. Here's August when I was thinking about this. And in the Apple Watch system, you're trying to close your rings. And so red is movement and green is exercise and blue is standing. And I can look at the whole month and see how did I do? Can you notice a trend? Is there a day of the week that it looks like maybe there's something else happening? All right, you're all seeing it. There's this one day of the week where look at that, like on the 4th and the 18th and the 25th, there was no exercise really happening and not closing that move ring. I started teaching a class and I was working 8 to 5 and then I was teaching a class from 7 to 10. And that idea of getting exercise, I am not a get up and sweat in the first thing in the morning kind of person, especially if I have to be at work at 8. So so I was struggling to figure out how to get physical activity. All right. Actually, this is Emily, this is like a longer ago. That was a time when I was doing a better job of keeping track. All right. My point here is we often use a lot of point in time data, and what we really need is to be able to have data where we can look back and see trends and see what's helping and what's holding us back and analyze it and say, okay, If I'm really going to meet my goals, then I'm going to have to change my strategy. And that's really what it's all about. Loving this, Megan. Um, all right. Now I'm going to talk about the performance management system. So if you looked at the link that was in the homework, you really only had two links in the homework. You saw this graphic before. You can see outside there's a black circle, and I'm not going to belabor that because we're going to look at that more through an assessment process here in a minute. But we need visible leadership and transparency and alignment. Strategic alignment is the thing I'm doing matters to a bigger picture. Like, help me see the connection between this thing I'm doing and why we're doing it. We need a culture of quality and we need a customer focus. Then there's the stuff in the center, and it's easier to read this way. So I'm going to show it to you this way. We have performance standards. How do you know the right things to do? It might be your grant guidance. It might be the public health accreditation standards. It might be last year, the outcome we had was this, and we have more staff or less staff now, so we can anticipate that we're going to be able to do more or less of that work. It's those benchmarks. It might be Healthy People 2030 goals. It might be something from the community guide. Wherever you're getting your evidence base, those are your standards. Then you have those measures, and we're going to talk more about that. This clearly defined thing of how you're going to know you're doing it. Then you have reporting of progress. It's not enough to just measure it, it also needs to go into a report. When I was first running a health promotion program, I did lots of reports for the Chronic Disease Risk Reduction Grant. Anybody else CDRR grantee? Not seeing a lot of health promotion buddies. All right, we had to report progress every quarter. We had to do reports. And one of the things that happened is that I was doing a very good job of keeping connection with my KDHE staff person who is overseeing my grant. And because we didn't have a performance management system at that time at the Sedgwick County Health Department, honestly, my boss didn't really have any idea what we were doing. Like, she had a high degree of trust that we weren't getting in trouble, and I was a pretty decent human being, so obviously things are going fine. But we didn't have a strategy for connecting the work of every program to a broader system of performance management. So reporting the progress to a singular system is part of the work. And then last, we have quality improvement. Once we have a report and we know what our measures are, we look at that and say, how can we improve? What are our opportunities to change and improve the process? All right, I'm going to keep us moving. All right, measurement. Measurement is the key thing here. Oh gosh, you guys, I'm only 4 minutes behind. I love it when a plan comes together. Like, I have this, here's the outline. We are on it. All right. So we've talked a little bit about measures. Throw some things in the chat for me, if you will, or you can come off mute. But what are some things you measure every day? And you don't have to do this for work. But if you have a measure that you do every day for work, power to you. What are some things you measure every day? I step on the scale. It doesn't tell me the story I'd like, but I step on it every day. You measure your coffee. All right.
Our team measures all communication with the counties that we talk to. So meetings, which I am a sucker for data entry, so it's right up my alley. The nurses struggle with it. They tend to have to go back to their emails, but mine's updated at the end of the day.
I love that. I love that. I love that you get joy out of that. Yeah, because of the work that I do, I have to track my time. So I'm tracking my hours, and I have a software system that I use to help me that's actually free if anybody needs a time tracker. Lucky you keep track of how long it takes you to get ready for work. I love that. I am a time optimist about how long it's going to take me to get ready for something. So that's nice. Oh, monitoring the progress in your garden. Love that. How much sleep you got. I bet you have are you using a watch or a fitness tracker to track that, or you just looking at the clock? Megan, tracking those timesheets. Jessica, how much you've read? Are you measuring pages or minutes?
I track how much I walk. I started walking, so I track how much I walk, one. And number two, I track how many clients I deal with on a one-on-one per day.
Yep, tracking those one-on-ones. Hector, are you tracking how long, like minutes walked or steps walked or miles walked? What are you tracking?
Time walked.
Time walked. All right. I'm emphasizing that because specificity matters. We need to be able to, like when we're trying to develop measures, not, for life, that's fun, but for work, we need to measure things and increasing specificity. All right, let's talk more a little bit about why measures matter. And very quickly, I'm going to tell you a story about making chili. I realize that it's like going to be pushing close in upper 90s today, so chili really doesn't sound good at this moment. But how many of you have made chili ever in your life? All right, for those of you who are chili makers, do you have a recipe or do you just throw stuff in? I just throw stuff in. And every now and then, my husband will be like, hey, honey, this was actually really good. Could you do it like this next time? And I always say, nope, because I measured with my heart. And, sometimes it's got a jalapeno and sometimes it doesn't. And sometimes it's got chili pepper flakes and sometimes it doesn't. And sometimes it's got, smoked chipotle seasoning because I have it and sometimes it doesn't. So, like, it's different every single time. It's not a lot different, but it's a little different every time because I don't measure. If I want to be able to improve it, make it better than last time, then I'd have to know better than what. I don't know what is when I'm making chili, and I don't care because I'm not trying to do it. I like just doing it the way I do it. Sometimes it's a bigger onion, sometimes it's a smaller one, right? So I love to just throw things together. But when I'm trying to make an improvement at work, I need actual measures. So you cannot manage what you don't measure. Like you can't know if you walked more yesterday than today if you don't measure the minutes or steps or miles. Like you need a measurement tool. Um, you don't know if it's getting better or worse. Like you have this feeling like things are sticky or things are yucky right now. Like you need data to tell you. Um, you can't manage for improvement if you don't measure what you're doing. So the measurement is key. And deciding like how are we going to know that we did a good job is really important. So start thinking of the measurement at the very beginning of the process. I've been working with one health department for 6 years on quality improvement, and um, their goal is to get 2 quality improvement projects done every year. And last fiscal year, they're on like the June to July or July to June fiscal year. Um, Last fiscal year, we got started on our QI projects in March, and we kind of needed more time than that. And they're started, but they didn't get done. If we were thinking about having the metric of making sure we got those projects done before the end of the fiscal year, we would have planned a time to start sooner. So, like beginning with the end in mind is really important. I love this quote. It's not my favorite quote from Deming. I have another one, but I love this. Without data, you're just another person with an opinion. And W. Edwards Deming is the father of quality improvement for the US. He did a lot of work in Japan on quality improvement with Toyota and others. In fact, if you watch the video, that little whiteboard video, you heard his name mentioned with Duran and another key person in quality that I can't remember right now. All right. We have 3 more slides about measurement. This one just breaks it down. How many of you have made a logic model? Like you had to do a logic model, maybe for a grant. This will sound really familiar and similar to logic models. The first level of measurement is how much are we doing? How many clients did we see? How many one-on-one meetings did we have? How many people came in for an immunization? How much? How many clients did we have in our WIC program this month? Like that's a nice clean measure. When we say levels of measurement, we're not saying one is a better level than another. Counts are really useful, especially if the thing we're counting matters. Like it doesn't matter for us to count t-shirts and water bottles most of the time, unless we're just trying to keep inventory because it's not leading to behavior change. But we're talking about like how much we're doing can be really impactful. The data has changed since I worked there because we have fewer births, because everybody has fewer births. But when I worked at the Sedgwick County Health Department, we had about 8,000 births every year. And we had about 4,000 infants enrolled in our WIC program. So we served half the babies in the whole county through WIC. I thought that was a really powerful data piece, and it told us how much we were doing. So being able to tell how much you're doing is important. I know one person on this call is probably not in the call right now because she had to go to a social media meeting. How much social media we're doing is really hard to calculate sometimes. So figuring out how much is not always easy. The second thing is how well are we doing it? So we're measuring the percent of people who are within our client pool that are vaccinated on time. How well are we doing it? How well are we making sure they're up to date? How well are we doing it? How satisfied are you with the training experience you have today? So there's lots of ways that we measure how well are we doing something. And then who is better off as a result and by how much? This is often the hardest one. You don't have to do this for performance management. I think those first two, output and process measures, are fine. Outcomes measures are honestly much harder to track. Like, who is better off? If we do a good job of delivering WIC services to these moms and babies, here's a nice, easy WIC measurement that we track. Standard in the program is we track healthy weight for the 2 and 3-year-olds, right? So who is better off as a result of participating in WIC and getting education and a lot of other factors? Are those kids at a healthy weight? That's one of the things that we track. So that's who is better off and by how much. So when you're able to think about how to break down a measure, it helps a little bit in trying to choose the right measures for your program. As you think about performance management systems and the prospect of building or using one, it helps to choose high power measures. And I got this stuff from Clear Impact, and I learned this 3 years ago, and I went, this articulates an idea that I had and breaks it down into components I can understand. So the idea is, does this measure communicate to a broad range of audiences? Does it tell a story? So for we serve half the babies, that tells a story. That's something we can all understand. Is this important and say something of central importance to the program? Have you ever measured something just because the data was available, but it actually didn't tell you something of central importance to the program? So I worked in health promotion, and we measured how many t-shirts and water bottles we gave away, how many pedometers, how many brochures did we hand out. Like, this is stuff we can do, but it's not of central importance to changing behavior. It might have been better to be, keeping track of how many calls to the quit line came from our county or something like that. And then data power. Is this data available all the time on a consistent basis? Like, will I be able to find this data next month? If Sonia quits, will we still be able to capture this data? We have the data available. I helped a health department build a performance management system once, and every single measure they chose was aspirational, something they were hoping to get better at, and didn't actually have a way to track any of that data. And it failed. In 2 years, they were building a new performance management system. So we've got to have data that we can actually find, use, that's available to us. All right. You've all heard of SMART objectives before. This is SMARTY. So we need to have specific measures that are, I remember just on the walking thing, I talked about, is that minutes, miles, steps. It's measurable. We have a way to quantify that measure. It's achievable. It's when we're trying to set a target, it's reasonable that we can reach 70% of our parents, or it's reasonable to achieve whatever the goal is. This is relevant. Doing this will actually have the outcome we hope to change. So will making a change improve something for the customer? Time bound, we're going to get this done, this week, this month, this year. What's our time frame? The IE are thinking about, are there stakeholders that have traditionally been excluded that we need to be trying to actively include to try to do a better job with this measure, and equitable? How do we mitigate unintended biases? How do we hold these ideas forward in our mind so that we can close equity gaps? And as a public health professional, as an aside here, you see that I put a source on here that I got this Smarty objectives concept from the CDC's website, from one of their cancer pages, and that's a dead link now because everything equity got scrubbed from the CDC. Just true. All right. We're going to talk about the foundations of public health, quality improvement. This is a very fast slide. There's a lot of words here. I'm looking for you all to help me locate what's one word that gets repeated over and over in these different definitions of quality. Yep, customer improvement. Lots of customer. Yep. Matthew, I think in your definition of earlier, you had mentioned customer as a key piece of quality, and Matthew does quality improvement at Sedgwick County Health Department, so I was like, yeah, he knows. Customers are at the core of this. We have to keep customers forward in our minds. This is a definition of quality improvement in public health. I'll pause to note the citation. This was published in the Journal of Public Health Management and Practice. As you run an agency or work in public health, the Journal of Public Health Management and Practice is a major journal in public health. And when you see articles published about what's happening in accreditation or what's happening in performance management, you often see them in this journal. The people that wrote this worked for the CDC. A couple of them are people from the Public Health Foundation, which is the group I consult with. And there's a representative from the Robert Wood Johnson Foundation. These are all real people, and with the exception of one of them, I know them all. Like, they're like humans that are in the public health system. It's not like it came from, I don't know, on high. Like, just people who work in this work tried to figure this out. And they came up with the idea that quality improvement in public health is the use of a deliberate and defined process. I'm going to stop right there. I think all of us are trying to do a better job today than we did yesterday. None of us wakes up and goes, you know, I'm going to go do it worse today. I think I'd like to try to be worse today than I was yesterday. That's just not how we're hardwired. We have some days where we're just present, right? Like, we're like, yep, it's a camera off day, or it's a I'm bringing as much energy as I have, and I'm at about 50%. Like, we all have those days, but none of us wakes up and says, I'd like to do it worse. Quality improvement is using a deliberate and defined process. It's intentional, like we're doing this on purpose. So we're structuring it through something like PDCA, which we'll talk more about.
This is the copier.
There we go. Thank you. All right. It also focuses on process. I underlined that. That's an emphasis that I added. It focuses on process. We want to create conditions around people so that they can do a better job. We're not trying to fix people. We're trying to fix the process so that the people can be more effective in it. That's what quality improvement's about. So PDCA, I bet you've heard of it before. We're just going to touch on this quickly. Plan. First of all, why is this important now? So you all talked about this already. Like, I need to have a motivation. Why does this matter now? Why should if I'm going to make a change, why does it matter? Things are not going the way we'd like. People are mad. We're getting bad customer feedback, something like that. An aim statement. That's basically a SMART objective. Who's going to do what, by when, and by how much? What are we trying to do? Examining the current approaches. How are we doing it now? What does this look like the way we do it today? Sometimes we do that in a flow chart. Sometimes we do that in a force field analysis. There are some QI tools to help us understand what are we currently doing. Then we look for some potential solutions. Like, what could we try? And then you develop an improvement theory. All right, we're going to try this, and this is what, we're going to try this for the next 3 weeks and see what happens. If you see a problem and you already know what the solution is, that's just executing a task. You don't need a quality improvement project to do it. So if you discover that we keep running out of toilet paper, figure out how to get toilet paper refilled. You don't need a QI project to do that, right? QI projects require a team to think out. Like some of you have done a leadership team training. It's for things that are adaptive challenges, for things that we don't know how to make progress on. We think there's a lot of things that might be at play. There are a lot of underlying causes. We're going to look for some root causes and consider what might be at play. Then we do it. We test our theory and see how it worked. We gather data and check the results. And then we decide, do we keep doing it like this? Do we adopt, adapt, or abandon this process? You can see that the plan phase has a lot more steps than every other phase. And sometimes teams get bogged down in the plan phase and forget to do it because they spent so much time with the QI tools in the plan phase. But figuring out what you want to do before you start doing it is important. This was a life-changing experience for me. I am a do, think, do person. Like, start doing something, then maybe think about it, then do some more things. PDCA really forces people to switch that around and say, all right, before we just run out to the store and start buying stuff, which is the way I start every DIY home improvement project, before we just run off with scissors in our hands, like what could we do that would be useful and important? And I love that because it makes us better. It really does. All right, customer focus. I want you to think about your last bad customer experience. What happened? Why did it matter? And what did you do as a result? And I'm not going to ask for a call out about this, but can I get some nods? I've had a bad customer experience. And did you like go back with gusto to that same place? Like I changed dentist offices because I was mad at my dentist. Like they were not kind to my kid on a bill and didn't give them any kind of guidance. Lori, tell us a story. Oh, she's just raised. Are you raising your hand to speak or thumbing up? Thumbs up. Okay. We all have bad customer experiences. Usually, when it's a really bad customer experience, we go tell stories, right? Like, this is an event. If you have a great customer experience, you rarely go tell, like, it's just expected. But if it's a bad customer experience, that's like a story you tell for the next 3 months. You won't believe this thing that happened to me. So, this is powerful data. People have bad experiences at our agencies. I want you to think about when you've had a great customer experience and maybe just drop into the chat. What is a place that you go where you routinely have a great customer service experience? I'll throw out Quick Trip. Quick Trip staff are so on it. Like when I walk into any other convenience store, I feel like I have interrupted the staff who are doing something else and I am an inconvenience to them. Quick Trip gets me in and out so fast. Like they are faster than I am. I can't get faster. Often, every single time I do this training, and I have literally done this training more than 100 times, every single time people say Chick-fil-A. Folks, that does not happen by accident. How many different chicken sandwich places can you go? There are so many. Like in our bigger cities, we have so many big chicken places. And Chick-fil-A has that process down pat. Think about if you've been to a Chick-fil-A, think about how it works. How the staff greet you, how they say nice things, how when their drive-through is backed up, they've got staff out in the drive-through taking orders. Like they have a process down. I love I think Lakia, I think everyone here is going to want to know where are you getting your car fixed because we all want good customer service at that. Safelite, that's a national chain that has a very clear process about how they deliver their work. Loving getting all of this. I actually I influenced a vacation my parents took once because I learned about a deli that had great service in Michigan and they decided to stop by it. And I did it from doing a training in Michigan. And people said, yo, you got to go to Zingerman's. And it was amazing. I'm glad you've had good customer experiences. When you have those good customer experiences, they didn't happen by accident. That isn't just that one good person said, I'm going to be better. Like I've known kids from like my friends' kids who worked at Chick-fil-A, and I've known those kids to be surly pains in my neck at youth group. And then they go to training at Chick-fil-A and voila, they turn into a human that can say all the right things to welcome and greet and close out a sale. They train them up. It's not on accident, it is on purpose. Quick Trip has literally written a leadership book about how to do the work that they do. Um, Good customer service doesn't happen by accident. So when we think about what quality is, it is entirely defined by the customer. What does quality look like to your commissioners? What does quality look like to your community? What does quality look like to the clients that you serve? What are their experiences when they come into your organization? What does it look like, smell like, feel like? Like, how are their senses influenced by being in your presence? You all have walked into another person's office and went, this is a place I'd like to spend a moment. And you have also walked into someone's office where you're like, I want to get out of here as fast as possible. That is design. We design the experience and the process that makes people feel those ways. They design that for um, Chick-fil-A, and we are looking to design that for us. All right. So when we are going to do that whole PDCA cycle to meet a customer's need and do it better, like when are we going to do that? I changed my view. There we go. All right. So let's talk about when we actually do this because it takes time. You don't just like do a QI project willy-nilly. It takes a minute to convene a team and talk through it. And some projects take a long time and some projects take a couple weeks. But we're going to do it when we have data that helps tell us that it's time to make a change. So it might be customer dissatisfaction data, like someone called, we got a complaint, um, or we've done an evaluation, regular survey data, and it's telling us we routinely have this problem. We might be noticing communication issues. We might notice that we have to go back and fix things. Like the report didn't work like it was supposed to because people didn't put all the fields in when they were entering data, and now we've got this mess and we got to go clean it up. Um, if you've got a lot of employee turnover, there might be a process problem that needs to be adjusted. Um, if there's technology issues, like what can we do to fix our technology issues? What intervention can we do? Um, if you're noticing a safety issue, long wait times are a big one. A lot of people choose a project because like I worked with a health department that had a family planning clinic that had a 180-minute check-in, check-out time. 4 hours people were spending at a family planning clinic. No, thank you. Long wait times. Um, or things get bottlenecked. Like everything's going fine until it gets to legal's desk, and then we can't get it off the desk and move on to the next phase to get it through the county approval process. And I'm just picking on legal because my husband was the county counselor. So I'm sure that never happens in your county. All right. So we're going to talk about performance management self-assessment. And this is where we're going to spend a little bit of time today. Let's see if I can attach a file to the chat here real quick. I'm going to, not this. All right. So we're going to do a self-assessment. So we're getting ready to move into some polling. And we're going to be talking about what it means to do performance management. So we've all done a self-assessment before. We're trying to give ourselves an honest assessment of how we're doing as an agency. And since you all mostly work for different agencies, this is not going to be a reflection on anything that anyone knows. No one's going to know your answer. It's all anonymous. So we're just going to, what we're going to get when we answer these questions is kind of a sense for how are things going in Kansas? Because we're from all over. We're going to get a little sense of how we're going all through Kansas. On that website that you saw, there was when we were talking about performance management, there was a performance management self-assessment tool. And this has actually been updated recently. And the performance management self-assessment tool is referenced in the FAB accreditation standards. Like this is one of the things agencies have to do, either this one or the NACCHO QI SAT. And I think the NACCHO QI SAT is great, and it's also super long. So we're not doing that today because it would take way too much time. We're going to look at this assessment, and we're not even going to do all of this assessment. We're looking at 5 areas, and we're going to do 5 questions in each of those 5 areas. So we're going to answer 25 questions. So the answers are not the most important part to me. It's the questions that drive my thinking. The questions help me think about this is what we're supposed to be about. So let's take a look at what some of those questions are. All right, I'm gonna switch the view here and show you. We are going to start with, there we go, now I can see you guys. We're gonna start with visible leadership. So if you're wondering where things are going, we're going to do 5 polls and 5 conversations. We're also going to take a break at straight up 10 o'clock. So if you're like, I need a coffee refill, hang with me for 17 more minutes and you'll get that chance. So we're going to talk about visible leadership. We're going to talk about these 5 questions real quick. So senior management demonstrates a commitment to utilizing a performance management system. If you couldn't name the performance management system your agency is using, then it would be hard to see that your visible leadership is happening, right? So if you do have a performance management system, then we probably have some visible leadership around that work. Visible leadership, senior management, and you in your own mind define who senior management is. That means different things to each of us. They demonstrate a commitment to a quality culture, one that where we're trying to improve customer experiences. 3, senior management leads a group to make sure that our performance management practices align with our mission. So we're making sure that we're measuring things that are going to influence improving the health of the community. Everybody's mission statement is something around a healthy community. We've got people who are trained to manage performance. They've gone to a training that said, all right, here's how you write a good measure. Here's how you track that. They've gotten some training around this. And last, managers are held accountable for developing, maintaining, and improving the performance management system. When I worked at the Sedgwick County Health Department, my director was Claudia Blackburn. And Claudia Blackburn had a measure on her evaluation that at least 75% of our performance metrics would be meeting or exceeding our goal in order for her to get all the points for that section. Like she tied her raise to whether or not we were doing this. She lived this in spades. Like she was holding herself accountable for making sure she was creating conditions for people to meet or exceed their goals. Not 100%, because we had some reach goals in there that weren't going to get met, but 75% we're going to do that. So I give you that example because it's a thing that can be done. All right, so I am going to introduce the poll now for you to answer those 5 questions. And as soon as I've got most of you completing that poll, you're going to answer for each of those 5 questions. You're going to say that always happens at your agency. It sometimes happens at your agency. It almost never or never happens at your agency. So I'll be quiet for a moment while you answer the poll questions. All right. I'm going to share those results with you all. All right, can you all see that? You should be able to control whether that stays on your screen and those results, but we're kind of evenly split on management You've got mostly people are supporting a quality culture, although not everyone. Mostly even split, but leaning towards always aligning. Not so sure about training the managers. Only 29% think that's happening most of the time. And managers being held accountable, 24% saying they're held accountable. All right, I'd like you to pause and think about that for a bit. And we're going to ask you to go and talk for like 3 minutes in a group. Emily's going to pop you into those groups, and your questions are in the chat. What makes progress in this area difficult? And what is working at your agency to support work and assuring that you have visible leadership? In these 5 questions, and what makes it difficult, and what's helping, what's supporting that work? Is that clear what you're supposed to go do? All right, you're thinking big picture about how does our agency work and what's helping us make progress. All right, we'll see you back in about 3 minutes. All right, welcome back. Before you start the next poll, let's hear about visible leadership. What's helping? I'm curious, what's helping support visible leadership at your agencies? Interested in a couple of stories.
Well, I will go ahead and go. But what's working for us at the health department is you can tell like there's been a lot of changes with upper management and senior management and leadership and all of that. But you can tell that they are all working together and having like weekly meetings, touch bases, what their expectations for like each of the team members are, each of the teams, and that trickles down. So like in a previous position, I was a leader at my last organization I was at. And so coming back to being not in leadership, I guess, seeing that there's a collaborative effort from all of the different directors and different team supervisors is really helpful from like being at the ground level, I guess. So it really does trickle down and like seeing that they're collaborative and they're engaged and they're
Yeah.
like engaged with what's expected of each of their teams really does like make its way to us team members, and that energy also correlates. So that really works for us over here, and it shows.
Remind us what agency you're with, Hunter.
I'm with the Sedgwick County Health Department.
Yeah.
Yeah.
It matters a lot that you can see this stuff. And leadership knows people are watching.
Hmm.
And sometimes they forget. Leadership teams, not yours, but there are teams that forget that they're super visible and they're setting the vibe and setting the feel. And clarity of expectations matters a lot. I'm seeing that show up in the chat here. Clear, consistent communication, um, transparency, attitude, communication. We're going to talk more about communication next time, but people need to hear this kind of stuff. That's part of visible leadership, is telling the story. And I think it's one of the hardest things because um, people who are the visible leader have to say the message many, many, many times, and they might feel like they're saying it like, I just said this. I said this last week. I said this 2 hours ago. I've watched the president of our university give the same presentation to multiple audiences, and I have to think, good gosh, you must be really tired of doing that presentation, but everyone needs to hear it. So I love that you lifted that up. All right. We're going to get one more poll and conversation in before we go. So we might be going at 4 minutes after for the break, but it'll be okay. Monica, great question. How do you engage senior leadership from below? There's a lot of strategies for that. We'll talk more. Let me think about that from a different perspective, but we're going to keep going. I'm going to do I'm going to cut our conversation we're going to do 3 of these. We got to do standards. All right, we're going to do standards. Performance standards. All right. One of the things that I think is tricky about this is when you see it, you go, okay, but then you're like, what exactly are we talking about? What do we mean when we say performance standards? So these questions help us consider that, and they're a part of the poll that's up. I'm just going to review the questions. The group the agency, uses performance standards. Like we have a reference point for what best practices are. The managers and employees are held accountable for meeting performance standards. It's in your work plan. It's part of the logic model. It's part of this tracking tool that we're doing using best practices. The performance standards, indicators, and targets are communicated. Like we know what we're supposed to do. Stakeholders know what we're trying to do. The group reviews our standards and targets. Here's what we said we were going to try to do, and here's how we met it. And we did this in a review session. And we've got training. Staff understand what are our standards and how are we getting trained for that. We've got 5 of you who have completed that poll. If you see it open, please go ahead and finish that poll and I'll share those results. Not rushing you. Just going to take a look at those results.
So it was immediately on my screen when we came back from our breakout groups, but I pressed close. Is there a way for me to go back into it?
I don't know the answer to that.
If you go to more and polls, it should pull it back up.
Oh, thanks, Afton.
Oh, shoot.
Oh, thank
Got
you.
you.
Got it.
That's
Because I
good.
did the same thing.
I was like, where did it go?
No, don't want that.
All right. One of the things I love about polls is you know you're not alone because somebody else is experiencing the same thing at their agency. And it's also, even if there's almost nothing happening at your agency, it's inspirational to know that it's happening somewhere. And so it is achievable. It could be happening. All right. I'm going to end this poll and share the results with you guys right now. So quickly, we've got some standards, almost always 44%. So that's a positive thing. Managers are held accountable sometimes. The standards are communicated. A little, only 25% said almost always. So 75% of the time, we're not exactly communicating what our standards and expectations are. This regular review process, 13%. So when I was starting at the health department, as I told you, like I just did my stuff and turned my stuff into KDHE and nobody asked. And that's really common as evidenced by what you're showing here. This regular review process is a key component of performance management systems. And you know there's a reason why we don't do it. People aren't trained and it's not held out as a must do. So it gets hard to do this. But if we can't improve if we're not managing performance and if we're not reviewing it and talking about it, how will we know? So it is fundamental to trying to do our best work to have a system that works. All right. I'm going to send you off to the same group for a 2 to 3 minute conversation about this idea. Same question. What helps and what holds you back? What is making it hard for progress in this area? Because there's a lot of not always or sometimes, you know? So a lot of you are in the sometimes or never category. What's holding you back and what would be supporting you? I'll be quiet. See you guys back in 3 minutes.
I think part of what holds us back is that like we only do reviews once a year and it's during our busiest time of the year. So I'm not focusing on what I've done for the last year. I'm focusing on the 4 flu clinics I have this week or all the school shots I have. So I don't think about everything else I did. So my evaluation, I can't talk about everything else because it's just not where my focus is at that point.
Yeah, I think figuring out when to do timing of tracking the performance of the agency makes a lot of sense. Thanks, Jessica.
Um, at the Sedgwick County Health Department, what has been helpful is the quarterly meeting.
Mm-hmm.
Every quarter, we meet to discuss and review the performance management of the whole agency,
Mhm.
like each program talking about what they have. And we look at possible ways to improve on things. And also, if your performance measure is in caution for 2 consecutive quarters, then you are to meet with the quality improvement team. You know, like even if the next quarter you are coming up with something good, but I mean, you just have to meet with the Q team and let's discuss how we can improve on the process. And also each year while we are setting up the performance um, measure objective for the program, like it's a yearly thing. So the program manager and the division directors are involved, and it has been very, very helpful.
Thanks, Matthew. That's been going on for like a dozen or more years. I think the history helps. And I think what you mentioned is really important is it's on the calendar. It happens every quarter. I don't know about you guys, but like just having something on the calendar for me is a big like, oh, I need to get this done before this meeting. So having a regular structure is very helpful. Having a performance management team is really helpful to making progress happen. So, um, having the history, having the continued commitment, being able to staff it, there's a lot of ways that Sedgwick County's been able to make progress. Thank you. All right. I thought over the break of an answer to Monica's question. Not the answer, one of many possible answers to that question. I think if we want to make progress on this work, and we want to make progress by leading up, which is an important skill to develop, being able to help senior leadership at your agency be the best version of themselves. One way to do that would be to simply say, hey, I'm in this Foundations of Public Health training right now, and the activity we did today, one of the activities we did today was a performance management self-assessment, and they stressed how important it might be to just consider the questions, even if we don't really want to answer all the questions. The questions themselves are interesting, so I'm just going to share the questions that we discussed with you today, and that might plant a seed. I think the questions are as useful as the answers most of the time. And to that end, I'm not going to do the entire performance management self-assessment with you all, but I am going to do the one more poll. So we're going to look at quality improvement, and I'm going to talk the questions and also launch the poll at the same time so we can think and talk about those together. So 5 questions in quality improvement. The manager's employees are evaluated for their performance improvement efforts. When I worked at Sedgwick County, every single person had a QI related thing in their performance job description and in their annual evaluation. 2, the organization regularly develops performance improvement or QI plans that specify timelines, actions, and responsible parties. So Matthew was just sharing that there's a quarterly meeting and that's part of the plan. Or there's a QI plan that tells us that we're going to do new employee orientation for QI, or we're going to make sure that we complete 1 QI project per year or 1 QI project per program. So the plan's going to outline that. 3, there's a process or mechanism to coordinate QI efforts among groups that share the same performance targets. So we have more than one program trying to ensure that we have healthy babies. WIC is trying to get healthy babies. The Healthy Babies program is trying to get healthy babies. The family planning program is trying to ensure we have healthy babies. Can we work together on a QI project to think about across programs? 4, QI training is available to managers and staff. We used to see a lot more QI trainings in the system than I've been seeing recently. Maybe you all are seeing them. I can't see everything that's happening in the system. So I'd be curious about whether or not you're seeing QI training opportunities. And last but not least, it's practiced widely across the organization. So I've got 5 of those polls done. When you are done, I will share the answers. All right. couple more respondents. Emily, will you shuffle them and send them to new groups this time? Already probably done. Thanks. All right. I'm going to end. There we go. I'm going to end this poll and share the results with you. Let's see what we collectively see in the system. Man, almost 60% of people are saying that quality improvement or performance improvement is part of their job in annual review. And having a QI plan, 40% of you are saying you've got a plan in place. Working across systems, 18%. That's hard. I mean, that's really hard. I think that's one of the hardest questions in this assessment. Training is available, 18%. What's going on in our system that makes QI training so hard to get? It really is important. Being able to do this well is improved when we have training. In fact, just-in-time training that will happen as we do the project can be really helpful. And it's practiced widely. 25% of you say it's practiced widely. There's probably a correlation between 4 and 5. If people aren't trained, it's going to be harder to practice widely. It's interesting that there's a plan, but less, like 41% say there's a plan, but only 25% say that it's being practiced agency-wide. So maybe there's some pockets of investment, but not agency-wide. So this is the last time we're going to send you to this small group. It's going to be a 3-minute conversation. I want you to talk about what's helping and what's holding back progress on this. And like as a little twist, I'm curious, like, do you think there's something that Wichita State should be doing? Like as we support the system, is there a way that we could help you with this quality improvement work? So I'm curious about that. Off you go. What's helping and holding you back for 3 minutes? We'll see you shortly. All right, welcome back from your breakouts. I know that was fast. All right, what's helping or holding back progress on doing quality improvement at your agencies? I'd love to hear 2 or 3 of you share.
It seems like every breakout, what I keep hearing is communication and transparency. So
Helping
like,
or hurting?
it can be both, and it's needed from the top down and from the bottom up. Like, they can go both ways. And it's just like preparedness. Communication's always the one that you have to work on when it's like you can never do it right, or not never do it right, but never do it perfect. It's always the
Okay.
one thing you can count on to work on, communication.
Absolutely. I don't think you ever nail communication. I don't think you get like max out, like we're doing it the best possible way. My husband and I are celebrating our 20th anniversary this month. We're pretty even, stable people who love and care about each other, and there are communication breakdowns all the time. It's just part of being a human. It's hard work. And it's even harder in agencies. Oh, thanks, Hunter. Other themes that you heard about what helps or holds you back from doing good quality improvement work at your agencies?
I would say that one of the things that holds us back at Shawnee County is that we have a QI committee, but it's advertised as like an optional thing, and it's kind of even like mentioned as like, I don't know, baneful, like OMG, does no one wants to join the QI committee? So I feel like just creating a different view of QI here at our health department would help. And like you said, the communication aspect, but also making it to where everyone is a part of the QI efforts rather than just a few certain people.
Yeah, thanks, Dante. And I think you guys have had some turnover in the QI coordination role or responsibility, so that makes a big difference. Um, yeah, most health departments that are like the size of Shawnee have a committee. Any of the accredited ones, like you guys, have a committee for quality improvement. So there are people who have more expertise than others, but also it has to be everyone. Like, and as you think about your Chick-fil-A or Quick Trip experiences, like we want good customer service experiences. So why would it be a bad thing to be part of the everyone tries to support quality improvement idea? I appreciate that. Thanks. Anybody else want to tell us a story about what's helping or holding back at your agency for QI?
Okay, let me talk about the Surrey County Health Department. At the Health Department, we have the Q team, we have the QI plan that Sonia helped us to put in place, and we've been reviewing that every 3 years. We also do new employee orientation that we talked about, intro to quality improvement. Uh, we have Q team, we meet every month, except for the month for the performance management meeting. But then on the Q team, we have a representative from each of the division. And I think that is holding us back. So the new QI plan we'll be working on for 2026 to 2028, following the nature survey that we'll be sending out. So the plan now is to ensure that we have a representative from each of the program instead of each of the division.
Love
So
that.
if we have people from each of the program, we believe it is going to help to get the programs to do more of QI projects and also help to build the organization's culture of quality improvement.
Thank you, Matthew. That sounds amazing. So instead of having 4 or 5, people from each of the divisions, you'll have more like 30 from each of the programs. So that'll really grow the reach of the committee. All right, thanks for sharing that. That's exciting. All right, friends, we're going to keep moving. So we've been talking about performance management. That's performance improvement is a large umbrella. There's performance management, tracking what we're doing, and then there's quality improvement to try to improve what we're doing. And so there are lots of QI tools that we use in the PDCA process, and I'm going to share with you 2 of them today. We're just going to play with 2 tools. There are lots of tools, and this slide helps illustrate that. Everything from aim statement. I mean, there's a long list here. This slide also tries to help illustrate that you use different tools for different things. So you don't start with 5 whys. You start with trying to think about what do we want to achieve through an aim statement. So there's lots of QI tools, but we're going to narrow our focus. If you want to learn more about those QI tools, you can do that through this Public Health Quality Improvement Encyclopedia, which isn't where I wanted to grab it, and I think that's because it's on my desk. That is where it is. This is because I was using it yesterday. So this is part of my QI Bible. I carry it around all the time in my work, and I carry it around in my pocket on my phone. This book, which is a spiral book, is 25 bucks. This app is free, and it's all the same content. So the Public Health Foundation turned this into an app just in the last 6 months or so. And I just think that's so cool that they've made that available and searchable maybe in the last year, because I think this was something I shared last time. So this is a great new resource. You're welcome to check it out in every app store. All right. So within that, I'm going to talk about flow charting. So we're going to talk about a flow chart. I suspect that most of you created a flow chart before. It's a diagram. It's also called a process map, and we're going to build one together today. This is my favorite Deming quote. I told you what the other one wasn't my favorite. This is my favorite. If you cannot describe what you are doing as a process, then you don't know what you're doing. If you can't say, well, the first thing you do is this, and the next step in the process is this. Most of us do lots of complex tasks all at once, and we mentally skip what the directions are. I use a lot of food analogies here. I bet some of you have had moments where you got to a recipe and you're like, something is missing here, because what it's telling me to do, like either I don't understand what that is, or it seems like they didn't quite explain, how do you know when you're done sauteing? Like, what does translucent mean for this? Like, how do you know? Or if you've ever watched the show Schitt's Creek, how do you fold it in? How do you fold it? Just fold it, David. Like, you need more instruction. Like, you need to know what are exactly the steps. So This is why every single project I work on with teams, I say they need a flow chart. What is the process we're trying to do? So a flow chart determines the boundaries of the process. So a really easy one to understand is the patient walks in the clinic, and the ending boundary is the patient walks out of the clinic. What are all the things they do once they come in and experience? We've all been a patient, so we all understand that basic step. What are all the steps in the process? What order should those steps go in? And then once we put it all together, we should like actually walk the process. Like, is this exactly how it works? Or is there some hidden step in here that we kind of forget about that we just all know, but we didn't think to write down? And then you finalize the flow chart. Why do you do this? This can be a useful tool for lots of different reasons. I worked with a health department that did pool inspections. In Kansas, we do pool environmental health. In a lot of ways, it's different than the rest of the country. But most health departments do environmental health and do pool inspections. And this was Houston. They had 15 pool inspectors. And all 15 of them had learned on the job by following around another pool inspector. I mean, most of us have followed somebody on a job to learn a task. Every single one of them did it a little bit differently. They got different results too, which was a problem, and the reason they were doing a QI project. So once they came to an agreement on what are the correct steps for doing pool inspection, then they were able to flow chart that out and make an improvement in their process because they all were following the same process. There are lots of reasons why having a flow chart can be helpful. There are lots of symbols on flow charts. Sometimes this gets a little overwhelming to me when I see slides like this. So I want to tell you there's really three. There's three symbols you need to know. And you can build a flow chart forever with just the start and stop, which is a circle or an oval, a little box for like the task. What's the activity that's going to get done? And then decisions. There are lots of decisions, and these decisions are binary. It's yes, no, or this or that. Okay. So the decision is not like this complicated thing where there's 25 things, an option. Every one of these decisions is going to be yes, no, this or that. I hope that makes sense. All right. Here's an example of what a flow chart looks like when it's done. And this is an example, this is a flow chart I did with a health department that was figuring out their process for how do they manage QI projects. So in their system, program managers would propose a project. So the program manager would meet with their team, they would propose a project, and then the QI team would review that project. So step one, the program manager completes a QI proposal form, and then they send that form electronically to the QI team facilitator. Then that facilitator sends it out to the QI team to review. Say, hey, we got a new project in. They would like some feedback. And they had determined that they would give their QI team 3 days to review it because you can't always respond to email today. So this symbol is the D is a symbol for delay. So it takes 3 days for the team to get back. And then the next step is the team members are going to approve or reject that project. So let's follow the path of what happens if they said no. Their decision was like no. Maybe they're asking for more information, like, hey, program manager, like, tell us more, because this doesn't sound like, figuring out how to replace toilet paper in the women's bathroom doesn't seem like enough of a project. So give us more. Then the QI team receives additional information, and they take time to review that, and they review again. They decide if they're going to approve or reject. So if they reject again, they say nope, and we just file it away. If they say yes, then that proposal form gets signed. It's the program manager gets notified by the facilitator, and they keep track of the projects that are happening on their shared drive. It's a pretty simple project flow chart. And you can see, what happens if yes. So eventually we're hoping to get to yes, and this is a form, this is a symbol for form. So really not that hard to do. We are going to build a flow chart together, and I'm going to send you guys to small groups to flow chart the start of the day. How many of you have done this flow chart before? None of you have done this. Okay, this is an activity that's pretty common in QI training. So we're going to have a pretend that the alarm has gone off. I realize some of you wake up on your own, but we're going to pretend that the alarm has gone off, and you are going to track all the steps that it takes to get from wake up to get out the door and leave or go to work. And like Emily and I went to work in our house. So maybe you don't go out the door, but just go to work. So you're sound asleep, the alarm went off at whatever time it did this morning, and you're trying to get out the door. And your assignment is to flow chart all the activities you have to do to get from that you are ready to log into this workshop today. So I'm going to ask you to brainstorm just a few, like come up with 10 tasks as a team that are kind of the ones that you do, and come up with a couple of decision points too. All right. I did this once where I mean, when we do this in person, I hand out post-it notes and people write on post-it notes. I had one woman outline her makeup routine in 25 post-its. 25. We're not needing quite that level of detail. All right. So, makeup could be one post-it. If bathroom can be one post-it, we don't need to detail all of the things that happen in the bathroom. So we're not looking like there's high level and detailed level. We're looking for higher level, but I'm looking for like there's several steps to get out the door. So I'm especially interested in ones that might be unique to you, like if you have to feed the chickens or, something that's not part of my daily routine, just because we're trying to have a little bit of fun with this. So again, we're going to send you to small groups. And when you come back, we're going to build a whiteboard of build a flow chart together. So I will see you guys in, let's say 4 minutes. Really importantly, come up with a couple of decisions that are yes, no. All right. All right. Thank you, Hunter. All right. I'll see you guys in 4 minutes.
Sonia, I forgot to ask, how big do you want their groups? Sorry.
Oh, whatever size they were in last time is fine. They
Okay.
can go in that same group.
Okay, cool.
All right, friends, welcome back. I can't wait to hear some of the things that you guys talked about. So to speed our process along, I have dropped in some of the activities that I think are pretty common to people's getting ready activities. But if you had something fun come up in your group that was either a decision or an activity, what was something that was fun that isn't already here? And you can just say it. Or you can add it. That's fine. We'll throw it into the mix. So we're just kind of using this space over on the right-hand side for brainstorming. And if you want to add something, you can, or if you want to shout it out, you can. But if it's not, I've already put bathroom routine and mindfulness and getting dressed and checking social media and kid management and breakfast and making breakfast and eating it and some sort of fitness routine and pet management and extra grooming.
Well, I think our group hit the snooze.
Yes. So that is pre-populated here. So the alarm
I didn't
goes
see
off.
it. Okay.
Yep, the alarm goes off, and the first decision all of us have to make am I getting up? So if yes, then next step. If no, hit snooze. So we got that process. Yeah, if my dad was trying to figure this out, his next step would be manage medication. My dad is like 25 medications. So maybe that's part of your routine. Anybody have another decision or an activity that you discussed that's not on this list?
One thing that changes my routine is if it's a hair wash day or not. Because if it's not, I can be ready in 23 minutes. If it is, it's a lot different.
I love the specificity of 23 minutes. That's fantastic.
I was about to say often that's another yep, I like exact time.
Yeah, so I'm going to throw the next step being like, maybe you guys don't have to go to the bathroom next, but that's a next thing for me. And then we'll just pretend some days are like this, so we've got hair wash day. So that's a decision that has to get made. And so we're going to put that right here. And if it's a hair wash day, then we know that it's undo. Then this is a yes, no. So if yes, then there's going to be a shower, right? Or
always a shower. It just is going to definitely increase my time. So hopefully I've planned ahead and woke up a little earlier or, you know, gave myself enough time.
All right, awesome. And if it's not a hair wash day, like you just go on with the regular routine.
Hmm.
So what's a good next step, anyone?
Makeup.
All right. See, for me, I would add another question here. So for me, I would say, am I on camera today?
Yep.
Because if I'm on camera, then I'll do makeup. But if I'm not doing it. Emily and I have lots of meetings where neither one of us are in makeup. So we might have a yes, no here. All right. Okay, so are there any other activities or decisions that people, yeah, this is a question of, do I have time for makeup, right? Maybe it's, maybe it's a different question. Time for makeup or shaving? Then if yes, do that. If not, then I'm going to continue with my regular routine. All right. Maybe I should be checking the chat for, oh, I have to let the chickens and the dogs out. That probably happened before the bathroom routine. All right, but we're going to add pet management here. So we've finished our shower and getting our probably pet grooming or pet management happened before many of these activities. I'm going to move this over here.
Another decision we had was, which I guess I can consider them pets, but I'm in my bird era. And so I have a bunch of birds I got to feed and water, and sometimes I have to replace the suet block, and that's a whole process. So, but that's only if it's gone.
Okay, that's a fun one. Replace suet block.
Because I have to wear gloves because I don't like it that it's greasy.
I really don't. Yeah, I really don't even want to know what that is. So, yes, oh shoot, I forgot who's on the phone. Emily, help me out. I also have kid management on my list, children management, like their hair, their outfits, their things. Okay. In the
That's Rachel,
interest
by
of
the way.
time, I'm not going to like finish building our flow chart, but you can see that there are nice, easy, if you're doing this with a group in real life, do it with a wide wall and sticky notes. If you're trying to flow chart a process that you actually work on, use sticky notes because it is so much faster and easier. If you're needing to do a virtual meeting, there are these whiteboard resources like Canva and Zoom and lots of them where you can brainstorm with your group. What are all the things we need to do? And then what's the best order for doing them? And you can easily copy and paste and move things around and decide what's the best order to do things. If you, what is something that causes you a delay in the morning? In addition to washing your hair or whether or not to do makeup, what's something else that slows you down? That if you were going to the airport that day and you had a 5 a.m. flight, that you would do something differently. What's something like that?
The temperament of my kid depends on how long my morning routine is.
So true.
This morning, the Ring camera caught him just sitting on the ground crying instead of getting in his car seat.
Those are hard days. Every mom's had a hard morning, mom morning, or the dog. Yeah. What has the pet done overnight or this morning? Did I wake up to poop on the carpet? You know, this is a real thing. I
If I
remember
got my
I have
clothes ready the next day.
yes. So so right here, I have choose something to wear. This can be a massive delay. for me. My daughter lays out her clothes the night before because trying on something and then taking it off and trying on something else, she didn't want to get sweaty. And that gets her sweaty, and she doesn't like it when she gets sweaty, so she wants all that stuff laid out in the morning. Her morning routine goes much faster. She can probably do it in 23 minutes. Because she figures it out the night before. When my kids were in middle school in Wichita Public Schools, they had uniforms they had to wear. They had to wear khakis and like a polo shirt. And Sunday night, I'd iron all that stuff up, and I ironed all their khakis, and we'd have 5 days of clothes ready to go. Monday morning, they were set for the week. We had the fastest get ready and go. If you're trying to figure out how to improve a process with your team, you map out the process and say, all right, are there some unnecessary steps? Are there things we can cut, things we could do differently instead? I'm going to stop sharing this. Okay, Afton, you don't know what kind of mood you're going to be in. All right, let me show you a completed version of this. Really, the aim here is to consider, are there things we can eliminate, or are there things we can do that would add value to make our lives better? So for example, I've got this flow chart that's a version of what we just did. So the alarm clock goes off and I pretty much always snooze, and there's some sort of bathroom, get dressed, go for a walk, breakfast and cool down. This is a pretty normal routine for me. And then shower, hair and makeup, getting dressed. I did this with a group that many of them had a mindfulness practice that they did before they got out of bed. One of the people in the group said one of their decisions is whether or not they're going to have a good day. Are there things that could add to your practice that would be better? I could get up and journal. Like I have aspirationally purchased many journals thinking that I was going to be a journaler. And, I'm looking off to the right because there's a huge stack of very nice journals and paper that, maybe I could add a practice. When I was going to the office, I would always make a decision about, do I have to pack my lunch or am I going to go out? There's usually some sort of gathering things up. Have any of you ever had that moment, like, where are the car keys? It was a long time in my life before I always knew where the car keys were. This gathering things up can take way too long. Where is my phone? Where is my laptop charger? Like this, we can improve our process by doing all this stuff the night before. You don't have to pack a lunch in the morning if you packed it the night before. If you're trying to do something faster, you have an opportunity to change. Mapping it out as a process is a way for you to figure out how to do it better. We do something silly because all of us have gotten ready to get out the door before, but there are real processes that we want to try to do in our agencies that we can improve if we all agree on what the process is. What is the process for getting a grant submitted? How much time is each step of the process going to take? All right, here's a quick flow chart quiz. Many people decorate for holidays. Insert holiday here. I've been looking around my neighborhood, lots of 4th of July decor. So imagine you are starting the holiday decorating process, and the first is you got to find all your stuff and you open it all up and stage it and see what you've got. And then you have that delay where you tell stories about, remember when we got this, or remember when the kid made this. So there's a little storytelling component. And then you question whether or not you've located all the supplies, and you set up your decor, and then you fix and untangle things, which takes a little time. So there's a delay. And then you take pictures of all your stuff and post it on social media and say, look at all this stuff. I mean, a girlfriend of mine sent me 5 pictures of her decorations for 4th of July. Are you satisfied with the result? If yes, you're done. If not, you might have to go get more supplies and set up more decor. There are some components missing on here. Help me out. What do you see? What's missing? No silence here. What's missing? So Mel's saying we need to go back and find supplies. So we've got, have all the supplies been located? There should be like a next here, right? Like if there's a no, if there's a decision, there should be 2 things coming out. every single one of these needs to connect to something. So here we need to go look in more places if all the supplies haven't been located and then get them back to staging. Or if we need more supplies and we need to shop, then we need to have something connecting the shopping to after shopping, we go set up more holiday decor. So we need to make sure that all of the outputs have a connection point. Yeah, a decision about whether you're actually going to decorate this time or not. So true, Monica. Like I definitely have 4th of July decor that I did not get out. And I just wasn't feeling it, so that didn't happen. All right, very quickly to wrap up. Here are the things that can go wrong with flowcharting. You can get too fancy with the details, which if it gets too complicated, unless you're trying to work on a very detailed component of a step, like the 25 steps for the makeup, too much. You can screw this up by not walking the process. You can make assumptions if you don't walk the process with a group and say, all right, is this really how it works? You can't do this alone. You really need to work with other people. Sometimes we aspirationally map the process we want to see rather than the way it's actually going. And that's not a bad idea. You can have a future preferred future map, but if you map the preferred future and you think it's what you're actually doing, then that's a problem. If you fail to explain what you are doing, I was with a health department that wanted to improve wait times in a particular lobby area. And the team that was working on that went down to the lobby and just stood there watching the process. They didn't alert the clerks to what they were doing and they totally wigged them out. So, like, don't freak people out. Tell people what you're doing, explain why you're doing it. They were feeling all kinds of feels that were not positive towards quality improvement. Look for opportunities to add value. We're not only looking for things to cut. This adding a journal or meditative practice is something I've considered a lot in my morning routine, like not identifying items of value. What could you do? Like maybe we need to pause and retrain. Like what are steps we need to add to our processes? Sometimes we have wasteful things. We need to look and identify the waste. We need to be clear about what our scope is so we know what the beginning and ending of the process is. Sometimes we forget that there's time or a lag that needs to happen. And the worst thing we can do is put this whole thing together and then not do anything with it. Like, let's use the flowchart once it gets made. So one QI tool that I use with every QI project is flowchart. I think it's really important to be able to understand what is it that we are doing. All right. I have about 20 minutes to talk about cause and effect diagram. This is another tool I do with nearly every quality improvement project. Honestly, all of them. Sometimes it's called an Ishikawa diagram or a fishbone, and we could talk a long time about the history, but let's just talk about what it does. This is really just a way to graphically illustrate a list of brainstormed possible root causes. It helps the team focus on the problem versus focusing on the history of the problem or, this is just a problem because when you had to work with Sonia, it was like this, like blaming people, individual people. We're not trying to focus on the personalities. We're trying to focus on what is the issue. And we're really trying to find root causes, not symptoms of the causes. We're trying to see what are all of the things that could be contributing to the outcome that we're getting. And at the end, it creates a snazzy snapshot that like we can see like, hey, look, this is what we're doing and this is how it's turning out. It's called a fishbone because it kind of looks like a fish. The effect is on the right-hand side. And then you have these major causes that you group together. There are some pretty standard names for those causes. Sometimes they look like this. The 4 M's, manpower, materials, methods, and machinery, that's historically what it was called. I never use manpower because in public health, there's a lot of person power. I don't know why we need to gender it. Sometimes people look at 5 P's and an E, policies, people, place, environment, etc. So the cause categories help. So for each major cause category, like if it's people, then we try to look at it and see what is it about the people that's causing the effect that we're getting. And sometimes we use a technique called 5 whys, which if we were doing a longer QI project, I'd explain to you. But we're really just trying to figure out why are these things happening relating to the cause. And I think this just makes sense. This is like learning how to play a card game. It's easier to do it than explain it. So let's just do it. Here's an example. Why are employees late for work? So there are some different cause categories identified here: work issues, transportation, family, culture, uncontrollable factors, procedures. All of these things could be reasons why people are late to work. If I look at culture, like the boss is late and it's an accepted norm and there's no value for promptness, these are all things that we can work on at our agency. If I was going to try to do a QI project to change and get people to show up for work on time, if I worked on these things, that would be a radically different strategy than trying to work on transportation, trying to figure out ways to help people get to work on time through transport. If it was a transit issue, is a totally different kind of issue than setting a good example as the boss. So this can help us think about what else might we do. I threw in another example. That's not what I wanted. Just doesn't want to let me advance. Here we go. I made this one yesterday because I was working on something for another health department. So this was thinking about employees are late to meetings. We all go to meetings. If we're trying to work on things like technical difficulties with software like Zoom and Teams or internet connectivity, or trying to work on IT support for when our camera doesn't work, because we've all had that moment happen, or software updates that happen. Have you ever like been going to a meeting and your computer decides now is when it's going to do a software update? Like these can make us late. That would be a very different thing to work on than if I was working on the fact that the people are multitasking and have difficulty transitioning from one project to the next, or they have poor time management skills, or they have a lack of motivation. That would be a totally different intervention than if I was working on the fact that people are distracted and we can't get private meeting spaces, or we have lack of parking or transitions. We've definitely had people get late to meetings because they couldn't get parking worked out. In fact, we're going to talk about parking for our next meeting at the end of this session. So my point here is when we look for these root causes, that helps us illuminate the idea that there are lots of reasons why things are happening the way they are. And there might be some interventions that are better than others to try to do. So we do these cause and effect diagrams to help us with that. I'm going to invite you to help me do another whiteboard activity. So let me open that up. It wouldn't let me open the whiteboard while I was still sharing my screen. There we go. All right. All right, can you all see a fish? Nod, yes, okay. So I'm going to invite you guys to help me think about public health staff are not routinely using AI to support efficiencies at work. And when I say AI, I'm thinking Copilot, ChatGPT, Napkin. Feel free to mention other AI related tools that are helping you, that might help you. So let's talk about what are some of the causes for why people are not using AI at work. So I'm curious if this is something that you can think of an answer to, which area would you like to start with first?
Maybe equipment.
Awesome. Thank you, Mel. All right. What kinds of reasons, what kind of equipment reasons would we have for people not using AI at work?
I was just thinking that we don't have Copilot installed with our Microsoft.
Kind of both a policy and an equipment, but IT has it blocked.
All AI tools?
Mhm.
Yeah. So the Public
The
Health Foundation,
policy,
go ahead.
like the policy, like your company has a policy, you're not allowed to use it.
Gotcha.
And like our policy says we have to get approval first, which, is a pain. You don't, you don't know what you want to use until you've tried it, but you can't try it till you get it approved.
That's fair. That makes a lot of sense to me. Yeah. Uh, I recently received a policy update that said we have to do a citation every time we use AI. And for generating content. I was like, what counts as content? Because I used AI to edit an email. Do I need to put a citation at the bottom of the email that says this was supported by AI? That feels a little silly to me. So like figuring out that policy space is really messy one. And if you haven't seen it, the Kansas Health Institute has an awesome policy template that people from our team at Wichita State and other places worked on supporting. There's a whole group that worked on it, and I think it's really well done. So I would encourage you to check that out. All right, so we've got policy problems, we've got equipment problems. Let's talk about some people problems. What are some issues for the people?
Fear
People
or lack of
oh,
experience.
yeah, maybe apprehension towards AI.
Yep, I like that. So I think that's a whole.
Say, given what I just heard about AI, I would have apprehension. I mean, the idea that you could use it the wrong way or something.
Yep. Fear
Yeah.
not, yeah, I fear I could use it wrong and some bad outcome could happen. What
Yeah.
else?
Just don't understand all the tools that are out there.
Yeah, the Taylor Carter at Wichita State runs a AI super users group and I attend when I can. It's really fun for me to listen to how people are using different kinds of AI tools to get their work done.
I would also say AI not having the capability to generate what you need generated, I guess, or to help you do your job. For example, I work in billing, so I work with a lot of coding and stuff like that. And from my understanding, AI is basically taught by people to generate its responses. So there might be a barrier in what AI knows to generate.
Yeah, I'm gonna put that in the process category because maybe AI doesn't generate accurate information. So there's concern about that. Is that fair, Dante? Yeah, I used AI
Yes,
to help
sorry.
me I saw the nod. I used AI to help me generate the history of using a Gantt chart. So I asked it to look this stuff up, and it definitely gave me information that was not accurate. Like human oversight is required. It was absolutely full out wrong by a whole world war. Like it was. Uh, so anyway, that was interesting to me. All right.
So does it feel like depending on what the subject is and what you're using it for, that it might cause you more work than not, or I mean, to not use it or no? I'm just curious because I haven't used AI.
I think that's a great question. I think it probably depends on the project or the time. Um, but some, you know, most of the time, I think it's an amazing time saver. But there are definitely times when I go down a rabbit hole, just like looking stuff up on Google. You
Yeah.
know, where you like start looking for stuff and then, you know, oh, where'd the last hour go? So it can be a time suck. Monica, I love that idea. Distrust of technology. I'm going to specifically say AI, like not trusting AI. Yeah, I'm with you, Emily. AI for me has been an outstanding brainstorming tool. But you can't, but I can't, like, I've never been able to just straight up copy and paste and go, look at this, it's amazing. Um,
And I don't think anybody should either.
yeah, actually. So I asked AI to come up with a cause and effect diagram for why people are late to meetings. And it gave me this super lame, only 2 responses per category, and I can't add more responses per category. And it was very frustrating. And so that did actually take way longer than I needed. I just ended up using my own brain to do it myself and make the one that you saw. Um, yeah, Monica, I love that. The perception that it's cheating. Where would you put that? Is that a people thing or a culture thing?
I think it could go either place, people or culture, because some of the more seasoned people, which is just a nice way of saying old, but it sounds better, right? They don't trust the new technology and stuff. And I have to say, a lot of times that's me as well. It makes me uncomfortable. So that's something I think is probably education in the tool and stuff and how you actually use it, because I am sure that some of that is going on, but yeah.
I think, yeah, and there's confusion too, because I was like, I wasn't talking about on the job, but like college students, as far as I know, they've been told not to use AI, but I mean, for like term papers and such, but I don't know, maybe that's different now. But as far as like, information or whatever, or not being like something that you came up with, or I don't know.
Yeah, I think it really depends. I think it depends on the instructor, depends on the field, depends on what they're trying to do. Um, I think that many of the ways that I use Copilot, which is the Microsoft thing that's Wichita State has we have a license for Copilot so that it's protected. There's a green shield that shows that it's not going out to the World Wide Web. But I'm I was looking for give me 10 evidence-based strategies for whatever the thing was. And some of them were good. It's the same thing I experience when I use Google. So I've used it really to search the web. Um, it really depends on what you're trying to ask it to do. I love your story, Emily. Uh, so sometimes ChatGPT and other ones just come up with stuff that's flat out wrong, which is why people need to engage their brain when they're using this. And the more I know how to write prompts so that I get the results that I want, the more effective that is. Um, so if you are looking at this and you were thinking, really, public health needs to catch up with what's going on with AI, and I'm not saying it does, but if that was our goal, um, which one of these areas would you want to work on first, do you think?
I'm going to start with people because not only do you have to get your people that are going to use it on board, but the people in leadership so you can create some of those good, solid policies and procedures.
Yeah. My thinking is that if you have staff under the age of 30, they're using AI for something probably. Um, Not having a procedure is not a response. Um, and frankly, I mean, the state of Kansas has a guidance for this that is for the whole state. So there are policies and procedures that we can build from. But yeah, if I were doing a QI project on this and I was thinking we'd really like staff to be using this, I'd be looking at designing a training that addressed all of these concerns. And that would be a QI project that would be totally different as an intervention than trying to figure out the software problem. That's a totally different kind of aim statement that we would be working on. Being able to break this down into these component parts helps us think about like what are all the things that we would need to consider in our intervention. So sometimes this is just another way to do brainstorming and helps us focus on the challenges at hand rather than focusing on individual people. So these are reasons that I enjoy using the cause and effect diagram. All right, let me just show a couple more things here. So to recap, a cause and effect diagram helps us identify, explore, and graphically display the issue that we're trying to do. We discover all the possible causes. It helps us focus on the content, not the history and the people. And it creates a snapshot of the knowledge of our team around a problem and helps us focus not on the symptoms, but on the causes, what's driving the result that we're getting. All right. So let's talk about barriers to sustaining a QI culture. I have a lot of concerns about our effectiveness at sustaining a QI culture within the Kansas public health system. I think that your survey results would indicate for the 3 things that we polled on that most of the time we're only sometimes or almost never doing some of these things, like having a performance management system and everyone's trained up on how to do it and all those kinds of things. So I think there really is a lack of knowledge. We've had huge turnover in public health everywhere, Kansas too, but everywhere. We did a leadership training, it wasn't last session, it was the one before, and we do this timeline at the beginning, and people sign in on when they started working in public health, and way more than half the people had started working in public health in the last 2 years. Like we have a lot of newbies, and so they probably haven't had training. Sometimes you see staff resistance. People are like, I do not want to do one more thing. This is going to take extra time. That vibe that Dante was explaining earlier, which I think is really important to consider. Sometimes people do QI and they get so wrapped up in like using tools and starting PDSA that they kind of forgot to focus on the customer data. So we have to come back to our roots about what are our customers telling us? And we could spend a lot longer identifying like who are those customers. Customers include your staff. Customers include your elected officials. Customers include the whole community and direct client service recipients. So broadly understanding what our customers are thinking. Sometimes it's really hard for us to gather that data. We really have to think carefully about how are we going to find out what our customers think. We've got that staff turnover that I already talked about. We have budget cuts. I know health departments that have cut positions recently. The budget's not always there for doing quality improvement, and crises come up. So I was just telling Emily, I'm getting ready to start a QI training series with a health department that had a natural disaster in their community. And it's been really hard to get a meeting with the people that I need to work with because they're doing disaster response, which is of course what they should be doing. I can tell you that I've been doing this work for 15 years. And in 2020, I had one project. Everyone was doing COVID response. I mean, when we have a crisis, quality improvement goes right out the window. And I didn't make up these 6 bullets. They come from an article that was a series of interviews that Pooja Verma and Jack Moran did with health departments across the country, asking them what keeps their QI work going and what keeps it holding it back. So we did a lot of information in one short 2.5-hour conversation. We talked about what's a performance management system, how important it is to have clear metrics and measures, the definition of QI in public health, PDCA cycle, why we need to focus on customers, and we practice playing with 2 tools. There's lots more we could do with that, but I was very happy to get to share my passion for doing this with all of you. Emily, do you want me to keep the slides going or do you want to take over?
Yeah, you can just keep them going. I'm going to go to a website here in a little bit, but for now, keep them going.
Sounds good. All right. So if you have questions, now's the time to ask them. I'd love to hear them. But otherwise, I'm going to watch the chat for any questions and I'll pop back in and answer them. But for now, I'm going to pass the baton to Emily.
Thanks. All right. So great overview. I always learn something new, and I love charts and graphics and all that stuff. So always fun for me. And yeah, as you're thinking of some questions, this is a good time because we're just going to do a quick debrief. I want you to think about a couple of things. What's one insight you're taking away from today's session? And what's one action that you could take to improve performance or quality in your organization or role? And I think we're going to send you to some breakout rooms to talk about that real quick. And I'm dropping the questions in the chat so that you'll have them when you go. But we're only going to take maybe 3 minutes to talk about it in your group. Think about those 2 questions and then come back, and I'd like you to share, a couple people share at least what you talked about. So just 3 minutes, I'm going to send you to a different room than you were in before, and we'll bring you back to do a quick debrief of today, and then we'll talk about next time. So I'll see you back in 3 minutes. Hopefully we didn't cut you off mid-sentence, but I'd love to hear from a couple of groups. What did you talk about? Either question. An insight you're taking away, or what's an action that you can take to improve performance or quality in your organization or your role? Feel free
I
to
can
come
go
off mute or drop it in
first
chat.
if you want.
Oh yeah, go ahead, Dante.
So what really stuck with me was the PDCA model. I was telling my group, it really reminded me of the scientific method that we learned like way back when in high school or school, whatever. And just like kind of taking in all of the details of our situation and data and creating a hypothesis and putting that into effect and stuff like that. So that really clicked with me. And one action that I think I could take to improve performance and or quality in our organization would be to just document and keep in mind of the changes and improvements that I'm making in my own job, and maybe even report that to our quality improvement committee, so that way I can help with the overall reporting of improvement for our health department.
Thank you so much. I love both those observations that you came up with.
We talked about the flowcharts a lot, and that like we all remember them from school, but remembering that we can use them in a practical way instead of just for like an assignment would be nice. And especially since we're usually working in different like programs and doing different events, it's a nice way to like keep everything organized and keep our brains focused on that idea and making sure we hit all the steps that we should be hitting.
Yeah.
Thank you. Isn't it nice when you're something in school that you're like, I'll never use this again, and then you come back to it and think, I can use this again?
I think I go next.
Yeah.
It is always nice to learn from Sonia. Like, this is like the third time I'm learning from her. Sometimes last year, 2 years ago, I had this scale population study, and she talked about quality improvement and performance management. Basically, everything that was discussed today is more or less what I do at the health department. So this is like a refresher that I never knew I needed. So it is a very good one for me. And I always struggle with the fishbone diagram. It's something I never wanted to, just play with at all. But from the extension today, I've been able to at least have a trick to it. So it's a very good one. And hopefully I'll be able to use the fishbone diagram in the next QI project or process improvement that we'll be doing at the health department. Thank you.
Thank you. And if you are able to take what you learned and implement that, and you want to share, we'd love to hear how that got implemented and what worked well for you.
Yeah, I will.
All right. Well, thank you all for sharing. Sounds like you had some good conversations, good takeaways. Continue to share in the chat if you'd like. We're going to move on to just a preview of what's coming next as well. All right, Oh, and I just put this on because I really liked this quote. If you always do what you've always done, you'll always get what you've always got. So not just for work, but in all aspects of our life, something good to keep in mind, I think, and something I need to remind myself of too. I love that, Hunter. All right, so looking forward to future things, I thought this was just a good time for us to do a reminder of final projects. I know some of you have submitted your final project proposal, so thank you. If you haven't, that's okay. Not due until August 7th. I think last time I said August 6th, and then we thought it through, and that's going to be the first day that we're together in Manhattan, and figured we could also give you another time. We can talk about it a little in Manhattan, and then if you're somebody who's a last-minute person, totally fine. And if you want to go back to your hotel and take what we talk about and plug it in, we're just going to make it due on the second day in Manhattan. So you've got an extra chance to talk to us, think it through. But just turn those in. And again, that is just so that we can see what you're planning on doing, help you brainstorm if you need any help with that. But let me change what I'm sharing. I'm going to just share what that form looks like for those of you that have not gone to it yet. Just so you know what we'll be asking for when you go into it. Sorry, I always have to remember how to get to another share screen. Okay, are we seeing the form here? Okay, so when you go into this link, the QR code, that's the same link that we gave you before, and thank you for dropping that in, Sonia. That's where you're going to go to fill in this form. Pretty basic. You're just going to tell us, mostly we want to find out what capabilities are you going to be focused on. You can check all that apply, but I will say we've had some people from the past group that checked all of them. We know that a lot of these projects are really going to focus on, are going to have a component for all of the capabilities. But I'm asking you to choose one main, maybe two or three main ones for this that you're really focused on, knowing that in the end you might touch on all of them. But what's the main one, maybe like I said, up to three that are your main focus for that? Give a brief summary of what you're doing and the objectives for what you're planning to get from that. How is this related to the course learning? So, you know, things that we've talked about in class or that you know from the core skills. If it's a core skill we haven't, or a capability that we haven't talked about yet, you do have all the core skills. So how are you going to tie this back to that? How is this something that you can take what you're learning from this program and apply it to what you're doing within your organization? I don't need a super detailed timeline, but just a basic, like, here's when we plan to start it, here's when we plan to complete it, and some of those major milestones along the way. You know, if you've got a big component that's stakeholder engagement, when are you planning to go out and talk to some of those stakeholders to get them on board for this? Those are the type of major milestones that we'd like to see in this timeline. And again, that's just to kind of give us an idea of what you're doing, when you're doing it, and if we need to help you keep on track, we're happy to help you keep on track with it. But this is your project. A lot of this is really just for you to help think through. What resources do you need for this? Again, this one is going to be basically for you, but this is to help you think through, as you're going in to do your project, is there anything that you're going to need from that? Do you need to talk to a certain person within your organization to even get approval? Hunter, some of you have filled this out before. I cannot remember who has already submitted it, but I'd be happy to tell you if you're one of them after I look at this. This is the same form that we've linked before, so you might have seen it, yeah. It's also the same questions that are on the last page in the final project guide, so you might have already seen all the questions.
Hunter submitted.
Thank you. Thanks for looking. Expected outcomes. what do you hope to get from this? This should tie back to what your objectives were. You should have something that you're hoping to get out of doing this project. Application of project results. How can you use these results in your professional work, or how will it contribute to your organization's ability to support the basic public health activities? You can put an NA on this if you don't have a mentor, but for those of you who chose to participate in the mentorship component of the program, this would be something really good for you to discuss with them. So have you already talked to them, or do you plan to get them involved and help with this? All of them have been briefed on what the final project component is, and they're all on board to help you think through if you really need it. And then just any additional comments. That can be blank, but that's if you have anything else you want to share with us. And also for most of you, I put a file upload. Most of you aren't going to have a file, but we have had some people who wanted to share something that was relevant to their planning for this. If you have anything to share, we're happy to look at that. And again, because this is a place to help you, if it's anything that would help you have your thoughts organized. One thing I will say is I realized afterwards that there's not a way for me to have you get a copy of this back. So if you've already submitted and want me to send you like a PDF copy of everything that you submitted, please remind me, because I do forget to go in and do that. I wish it was an automatic thing, but I can definitely do that for you. Yeah, thank you, Hunter. You might want to email me, but I will definitely get that to you afterwards. The other thing I wanted to share on the final project parts is just a reminder that in the resources page, you can find the final project guide. That's going to have the information that I just shared. Sorry, I'm trying to move my little share bar here. But one thing, if you haven't started thinking a whole lot about it, is to go into this guide and just a reminder that we have some topic examples. So my first step that I would recommend to you if you're stuck is think through what are you most excited about as a capability. Say you're thinking, I'm really excited about communications. I would like to do a project on communications, but I have no place to start, no ideas. We just gave a few ideas of each capability. It is definitely not limited to this, but this is to help you think through what are some ideas of things I could do. So if you're interested in communications, maybe there's a need in your organization to create an organizational brand and communications policy. If that's a need in your organization, that would be a great project for you. These might also just help you spur some ideas. Honestly, going back to the AI conversation, this is something, if you're really stuck, you might put in and say, I'm really interested in the communications capability for the Foundations of Public Health. I need to do a final project. That's what I've learned from prompts with AI. If you can give them the background and kind of say some things, they're really good at helping brainstorm. I keep saying they like it's a real person I'm talking to, because sometimes it feels like it. Honestly, that's what I've used AI for so much, is just the brainstorming, taking that brain power of just getting ideas started. So ChatGPT might give you some really good ideas that you hadn't thought about if you're really stuck. But as Sonia put in the chat, if you need a brainstorming partner and you don't have a mentor, or you want somebody in addition to your mentor, talk to us. We'd love to have some time with you to talk through what you're thinking, what you're passionate about, what might be helpful to your organization. The last thing I wanted to share, which is also linked on the resources page here, is the poster template. And so this is just a reminder that you don't have to do this right now, but this is what you're going to be sharing with the group when you get to the final, our final session. So each of you will be filling in this final project template. Or like I said, if you want to make your own poster, you are welcome to do that. There are lots of free poster templates out there. This is just one that I set up to make sure you know what we want to see. And this will tell you, you can zoom in, because it's set up so that if you printed it, you could take it to a print shop and get one of the like academic poster size things. So You will want to zoom in so that you can actually look at it and type, but you can see that the things that we're going to ask, we want you to identify what capability did you focus on? What were the challenges and opportunities you identified? So this is like, why did we identify this as a project that would be helpful to the organization or to your professional growth? What were some of the key steps that you took? List those out for us. Share any tools or ideas that went into this. What were the results and the reflections? So we'd like you to summarize your efforts. If there's any charts or pictures or anything, pictures are great. If you've ever been to a poster presentation at a conference, people aren't going to come to you if you don't have charts or pictures. They don't want to come read this thing full of text. So I'd love to see if you have any results that are visually appealing. Stick those on there for us. Inspiration or approaches. What was some inspiration for you? Were there any models or frameworks or published results that helped you guide your work on this? And then what were the partnerships and participation? I will also show that you can move these around. I don't have it locked. So play with size, move things around. Honestly, this is just a template for you to know the kinds of things that we want you to be able to share with the group when you give your presentation, which again, a reminder, presentation is like 5 minutes. So we're going to have this visual of the poster that everybody will be able to see. We'll upload a PDF of each of them so that you guys can see what everyone's done. You're just going to share in a small group, maybe 5 people from the class in a breakout group to just share what you went through. So when you think of presentation, don't get hung up on it too much. It's a really short presentation. All right. Any questions before I stop sharing? Before I stop sharing this, any questions on like what this template looks like, what the form looks like, or just questions in general that I can help answer for you guys? Okay. If you think of any.
Hey, Emily.
Yeah.
Once we submit, will you give us feedback like, yay, good idea, or like, no, maybe you need to rethink this?
Yeah, and for those of you that have submitted, I saw that you submitted. I just haven't read through them yet. But yes, I plan to go in there and we'll read through them. Like I said, we're not being super critical of it. Most of the feedback that I gave people last year when they submitted their forms was, hey, you focused on all the capabilities, which is awesome, but how do we narrow this down? Or super great idea, but this is something that is a very long-term plan. Is there any component of this that you can narrow down to be a shorter, small piece? So that's the kind of feedback that we'll give. But yeah, absolutely.
Or this project looks interesting, and here are 2 or 3 resources that just happen to be top of mind that may or may not be helpful to you. Just like, it's going to be pretty brief feedback.
Oh,
yeah.
I just don't want to go down the rabbit hole and then like, this is not even a good idea to begin with. So
yeah,
thank you. I appreciate that.
We will absolutely review. I was just giving, like I said, I know I think there's only 3 or 4 of you in there right now. And so I was just giving it time to get a few more, and then we'll review and give you this looks great, or here's some changes we want to see. But last year we didn't like completely make anybody revise, and I don't anticipate that we would do that this time either. Good question. And yes, thank you for posting that in there. I wanted to show you guys what that poster template looks like, but you do not need to have the poster to us by August 7th. The proposal form is the only thing you need by August 7th. The poster you won't need to have done till November. So thank you for that. All right, let me change back to what I'm sharing here. And we're just going to move on to what we're going to expect for next time. Sonia dropped the homework in the chat. It is a little bit longer than last time, but it's not 2 pages long like the other time. Let me see. Hunter Poster or just a PDF version? Oh, just the PDF. Yes, just fill out the PowerPoint. You do not need to print a poster. The only reason we made it a poster template is if you guys want to run with it and you do something cool, that would be really awesome if you wanted to take it to something like Kansas Public Health Association, governors. It's just so you have it there. Yeah, we'll be sharing it just in the PDF version with your group. Good question. All right. Sonia dropped a link or a poll in the chat. I have just found out this is my best way to make sure I capture everybody. So if all of you could just put your name and a yes or no for hotel rooms, I will make sure that we get those confirmation numbers to you guys beforehand. We'll be staying at the Hilton Garden Inn in Manhattan. It's on the, help me out, east side, Sonia? Right when you get off the highway. Like if you're familiar with Manhattan, it's by the mall, and you can see that on day 2, we'll be at the Flint Hills Discovery Center. So we did that intentionally so that from your hotel, you can just walk right over to the Discovery Center for day 2 and stay parked where you were for hotel. So we will be focusing on community partnerships, communications, and we will have a little bit of leadership and governance. Because again, with our in-person sessions, we really tried to make it so that we weren't making presenters drive super far. And it worked out really well for our presenter for leadership and governance to be able to come to Manhattan for us. So a little bit mixed in there on our communications day. Day 1, we're going to be on K-State campus at the Vet Med building. And here in a minute, I'm going to show you a map with parking. Sonia mentioned it a little bit earlier, but we want to make sure that we've got the parking issue taken care of. Day 2, we'll be at the Flint Hills Discovery Center. And like I said, that's right next to where we'll be staying for the hotel. So you'll be able to just walk over from there. I think part of our meeting agreement is you get to actually have admission to the Discovery Center. So we did intentionally put in some breaks so that you guys could do a little exploring in there. I've never explored in the Discovery Center. So we were excited to be able to have that space as our meeting space. It looks like everybody has answered the poll, so thank you very much for that. Sonia dropped in the homework, and now I'm going to change my sharing again because we learned lessons from last year for parking, and we want to share those lessons.
This may be the most important thing you hear before you come to Manhattan. So, like, if you're multitasking, Emily is about to tell you something very important.
All right. I will be sharing this. This will be posted to the resource page, and I'll send it out in an email. But we learned important lessons from parking. We loved being on K-State campus for day 1 of our meeting, but we learned lessons on parking. So because it's on the campus, every car does need to have a parking permit. You can get a temporary day parking permit. It's only $6. And that is our big recommendation for what you do. And to do that, we have learned that you need to call K-State Parking Services. Sonia and I had a talk on this. I don't like calling people, but you have to call. We tried to do it online, learned from parking services that there was something with students parking in visitor spots, and they took away the online option so students didn't abuse the system. So it made it so we have to call. But you can call anytime.
And it was painless.
It's super easy. Yes, it's super easy. It'll take you a few minutes, and you can even call today and just give them the day. So call today or anytime between now and then. You can call that day of even, because it only takes a few minutes, and tell them you need a pass for August 6th. You do need to have your vehicle make, model, license plate number, and your credit card, and then your license plate number is your permit. So when you give them your license plate number, if anybody scans your license plate in the car or in the parking lot that day, they'll see that you have a permit. If you have a buddy in this class and you guys want to meet up for lunch first and carpool over to the lot, you can do that and share the cost of parking. And then the other thing to remember, and again, I'm going to post this, you don't have to write down all this information, but when you look at lots, those are the letters on the lots where you can park with your visitor pass. And we've got a map with the best place we found to park. because again, this was a big confusion last year. It got us started late, so we're trying to mitigate. So right here is where we're going to go in, and you'll have an exact address and all that. But where we found the best place to park is right back here in these two parking lots. They'll say letter T on the pole. That means you can park there with your visitor lot, and then you just walk along the little path and go in. Last year, our person that helped us coordinate gave us some like metered parking that we could park in. What we found was the meter was like this little brown spot right there. There was maybe one spot. You couldn't stay there more than 2 hours. We had a big confusion last year, guys. So that's why Sonia said, this is the most important thing for coming to Manhattan. Just park in this lot. You'll be fine. You can also park anywhere it's purple or light blue, but this is going to be the easiest for you. So sorry to make the parking sound dramatic, but again, it got us started late last time. So we're
And we
really
just want
trying
to start off on a happy note,
Yeah.
and we're all coming back together to be in person, and it's a really fun day at K-State. So we just want to like start the day chill. So, maybe aim for 12:45. Just food for thought.
Yeah, good call. You don't want to get there and then we had a lot of people that were super flustered starting out the day, and we don't want to start flustered. So just trying to set everybody up for success. Oh, Dante, I don't know about the handicap placard. Do you happen to know that, Sonia?
I do not, but we will find out and message you before this event.
When I'm making myself a note. When I call to get my own parking permit, I will ask about that. Okay, thank you for the question. Okay, any questions on next time, what we're doing, where you should park? Any questions in general about seeing you next month? Okay, yes, and final step, because you guys have seen in your weekly emails, I'm gonna bug you if you don't do it, because our evaluator, she tells me to shame you. I'm not shaming you, I'm bugging you, but we need evaluation feedback. So Sonia dropped the link in the chat. I have a QR code on the screen. We would love it if in this last 5 minutes, you just go ahead, pull that up, and take the evaluation. We have no other content for you, so I'm going to leave it with you taking the evaluation, and we're hanging out here if you have any last minute questions for us. But if you don't have questions and you've done your evaluation, then you're free to go. We've loved seeing you. We look forward to hearing from you in between, and then looking forward to seeing you in person in August.
Quick question, is this recording going to be in our resources?
So we are recording, and I've just been sharing out the link to people that need it. If it's, I mean, I guess, is that something you're interested in if we just share all the recordings?